Good morning and welcome to Trevor Phillips on Sunday. Hands, face, space, they lectured us day after day. Well, the hands and face of former Health Secretary Matt Hancock were pretty active in the video we saw last week, but there wasn't much space at all between him and his paid advisor. And that in the end is why he had to go. Those of us who make these rules have got to stick by them, and that's why I have got to resign, he said. But only, it seems, after fellow ministers and MPs told him that he'd become toxic. Last night, he departed for a period of political self-isolation. Former Chancellor Sajid Javid steps back into the cabinet as the new Health Secretary. In the next hour, we'll be talking about what the resignation means for the credibility of the government, the leadership of the NHS and the country as we emerge from the most serious public health crisis of the past 100 years. Northern Ireland Secretary Brandon Lewis will be talking about Matt Hancock's dramatic exit from the Department of Health. Labour's Lucy Powell tells us why she thinks Mr Hancock should have been sacked before he got the chance to walk. We'll be speaking to the chair of the British Medical Association, Chaand Nagpaul, about the challenges facing the new Health Secretary, and asking one of Britain's leading public health experts, Linda Bauld, whether the public can be expected to follow the rules when ministers don't. And finally, we've got a man who's been there and done it, former Health Secretary Alan Johnson. But first, let's get the view from the Cabinet. I'm joined by the Northern Ireland Secretary Brandon Lewis.
Good morning.
Mr Lewis, why did it take Matt Hancock 2 days to be dragged, kicking and screaming, from the Department of Health?
Well, I don't think that's a fair description, Trevor, I'm afraid. I'm going to have to disagree with you on the first part there. Look, I think quite rightly, Matt has been focused all through this period, the last year and a half or more that we've been all dealing with this, the dreadful situation with the pandemic, and focused on delivering for people. He wanted to stay focused on that. The government want to stay focused on that. We've got a strong team at the Department of Health who have got that knowledge, that experience to take that forward. But look, Matt in his own letter, I think, said, and ultimately he's made, I think, probably the right judgment in the sense of he doesn't want this situation around himself to distract from that key focus and the key work for government, which is to deliver for people on the pandemic and as we are coming out of the pandemic.
The Secretary of State for Health, formerly, spent much of the past year telling the rest of us how to live our private lives. He shamed people, Neil Ferguson, the scientist, for example, who broke the rules. And yet, he then spent 2 days telling everyone that it was vital for him to stay in office and that they shouldn't judge him on the basis of his private life. He doesn't get it, does he?
Well, I think, as Matt himself said, he apologised for what he had done. He apologised for breaching the guidelines. We've all got to do our bit. Absolutely, he's been right all the way along. We've all got to do our bit to follow the guidelines. That helps keep not just ourselves and our friends and our families, but our wider community safer. But as Matt said in his letter yesterday, he didn't want his own situation and what he had done in terms of breaching the guidelines in his private life situation to distract from the important work that we've all got to focus on. I know Sajid Javid will be focused on, which is taking our country forward through the next stage of the pandemic and as we are rolling out of the challenges of the pandemic, as we continue the vaccine rollout. That's been a phenomenal success and something Matt and his team should be rightly proud of.
Yeah, but this wasn't he forgot his mask when he went into a shop. This was something quite different. He carried on a relationship, fair enough, but in that relationship he did things that he was telling the rest of us that we may not do.
And as Matt said in his resignation letter, you know, this is one of the reasons why he took the decision. Having given it some thought, I think he took the decision, as he said, that it was right for him to not be a continual distraction, that what he did was wrong. That's why he apologised. And he wants the country to have the ability to focus on dealing with the pandemic. And as I say, this next steps as we are coming out of the pandemic. And I think it's a credit to Matt that his first thought is around making sure the country and the government can continue to do the work we need to do as we are moving out of the COVID pandemic.
But, Mr Lewis, look, let's get to the root of this. Anybody can make a mistake, but both Mr Hancock and Mr Johnson, for 48 hours, carried on as though it was a minor slip, nothing was too wrong. And there is a sense this morning that Matt Hancock resigned not really because what he thought what he had done was wrong, but because everybody else is saying it's wrong. And the Prime Minister doesn't quite, in his letter, say, Matt, what you did was wrong and embarrassing. In fact, he uses the phrase, you should be proud. Are Matt Hancock and Boris Johnson the only people in the country who can't see why the real reason he had to go?
Well, again, Trevor, I'm afraid I disagree with the premise that you're coming from. I think it's right that Matt and his entire team, there's a really good team at the Department of Health with Nadine Zahawi obviously leading this phenomenal vaccine rollout, Ed Arger, James Bethel, the entire team there, Nadine Doris and Joe as well, Joe Churchill taking forward the work to make sure the country is able to deal with the pandemic. And I think Matt should be proud of what he has seen at the health. So it's not just dealing with the pandemic, which has been something none of us would have found an easy project over the last year and a half. And he's done that with clear focus and vigour to deliver for people across the country. And the vaccine rollout, but the technology improvements in the NHS, the work to make GPs more accessible and to be ready as we're coming out of the COVID pandemic. I do think it was right that the Prime Minister and Matt were focused, even in the last couple of days, on making sure that experience, that knowledge that has been gained through the last year and a half or so of dealing with the pandemic was there to be able to focus on the pandemic. I don't think that is in any contradiction at all to Matt, after a day or so, taking that opportunity to look at the situation and to reflect and decide that his position was distracting from the work as we come out of the pandemic. And I think credit to Matt that his focus is not just on his family, but on the wider country and the best interest of the UK.
Let me try this another way. If something like this had taken place in your department, the Northern Ireland department, involving one of your junior ministers and a person working for the department, I want you to tell me that it would take you 48 hours to decide that something had to be done and that actually you, like the Prime Minister, wouldn't say to that junior minister, you've got to go.
Well, the reason I never, ever, in any interviews over the years I've been talking to colleagues and yourself, Trevor, on a range of interviews, I never get into the hypotheticals, is because every situation has its own unique circumstances you have to consider. And even in this situation, Trevor, you've got to look at the unique circumstances of a situation like the pandemic, with the knowledge and the focus and the experience that Matt had had leading the department through the pandemic, and the desire to keep the focus on how we use that expertise and that knowledge to take the team forward and the country forward. As I say, I think Matt has made the right decision. I think he's done it with the best interests of his family and the United Kingdom at the forefront, and credit to him for that, because he didn't want his situation to distract from things. You've got to look at these situations as they develop in real time with the specific knowledge of that particular situation. So you can't do hypotheticals across different areas. Our focus for the government, I know Sajid Javid's focus, working with a brilliant team at the Department of Health, will be on moving forward the next steps through and out of this pandemic.
All right, well, let's leave Matt Hancock himself alone for the moment and talk about the government itself, because, as you say, the government's got to take this forward. Now, to take it forward, the government has to retain its authority and know that people are going to listen to it. Now, let me put this to you. What it might sound like to the person in the street is Cummings and Barnard Castle hypocrisy. Matt Hancock and some bloke he knows gets PPE contracts, cronyism, carrying the wallpaper in number 10, profligacy, and now snogging videos from the guy who tells you you can't hug your gran. One rule for us and one for them. Are you about to squander all of the credit that you have built up as a government in the successful vaccine rollout?
Oh, well, actually, as I say, I think the vaccine rollout has been a phenomenal success. That's a credit to Nadine Zahawi, Matt Hancock himself, and the entire team at the Health Service.
Yes, you've told me that 5 times, but I'm asking, are you about to throw all that away?
No, we're going to be focused on continuing to roll out the vaccines. We've got 83% of the public had that first dose now. Over 60% had the second dose, and half of under 30s as well, which is brilliant, but we need to continue to focus on that. And I think ultimately what the public want us focused on, what my residents in Great Yarmouth and people I talk to people in Northern Ireland want us focused on, is getting on with the job of government, making sure that we can continue to deliver on that vaccine rollout, keep it going, keep moving out of the pandemic, build back better, and be ready for the opportunities that lay ahead for the United Kingdom.
Mr. Lewis, I wouldn't normally do something like this, but I want to put a personal question, I guess, in a way to you. Over the past 2 days, every cabinet minister, including you, has come out to essentially defend the Prime Minister and Matt Hancock. The pictures that we saw were of an encounter on May the 6th. On May the 11th, my family buried my daughter, who had died not of COVID, but during the lockdown. 300 of our family and friends turned up online, but most of them were not allowed to be at the graveside, even though it was in the open air, because of the rule of 30, because of the instruction by Mr. Hancock. Now, the next time one of you tells me what to do in my private life, explain to me why I shouldn't just tell you where to get off.
Well, I absolutely accept and understand the frustration and even the anger that people have, having been through the situations they've been through. Look, as you say, Trevor, people across the country, I've lost friends whose funerals I've not been able to go to over the last period. That is such a tragic situation for any of us to be in. And that's, I have to say, why it's so important all of us do what we can to keep ourselves, our families, our friends, our wider community safe. It's also why that what Matt did was wrong. He acknowledged that. It's why he apologised immediately for his behaviour and acknowledged what he did was wrong. And it's ultimately why he's taken the decision that his position was untenable and distracting from the wider work that we've all got to do to move forward in the pandemic and out of the pandemic. There's no getting away from that, and I think that's why Matt ultimately made the decision he did. As I say, I think in doing that, he has put his family and indeed all of us across the UK first, because he wants to focus, as the PM does, as we all do, to be on getting out of this pandemic in the best possible way and as quickly as we can.
OK, I'm going to have one last attempt. Does any of you understand the fact that it took 2 days to get to this point feels to everybody who is not you like he only stepped down because everybody else was shouting at him, not because he or the Prime Minister actually understood what this feels like to everybody else.
Well, as I said, Trevor, earlier on, I'm afraid I don't disagree with the premise you set out. I think the Prime Minister and Matt, and I think people will see that the Prime Minister and Matt Hancock were focused on dealing with the pandemic. That's what they saw as the prime thing. Matt accepted what he did was wrong and apologised for that. And I think credit to Matt that he's looked at it again on reflection and taken the view that his position was distracting from that wider piece of work. He wants, like we all want, our focus to be on dealing with the pandemic and the next stages as we come out of that. And that's certainly where all of the government's focus will be. And Sajid Javid and the team of the Health Department will be looking forward to how we develop out of the pandemic from a health sense, as all of us will more widely as a country, as we build back better in the future.
All right, we'll come to Mr. Javid's challenges in a moment, but before we do that, I want to ask you about the security aspects of this. You are well versed in this area, though, of course, this specific issue will not be your responsibility. We don't know exactly how anybody came to be in possession of these pictures, but presumably the government will be undertaking an urgent security review, because how is it possible that what goes on in a minister's office or behind a closed door for a minister can be made public in this way? I mean, for Matt Hancock, it was embarrassing. I think in your case, it could be lethal.
Well, look, Trevor, you're quite right. And I've seen some of the reports this morning outlining how different journalists think that the tape may have got out there. That is certainly a matter I know the Department of Health will be looking into to understand exactly how that was recorded and how it got out of the system. It's something we need to get to the bottom of. As you say, quite rightly, what happens in government departments can be sensitive and important, but people need to have the confidence that what is happening in a government department is something that allows government to be focused on those core issues and the sensitivity sometimes in a security sense of those core issues. So yes, I do know that is something the Department of Health will be taking forward as an internal investigation. We'll need to see, let them have the space to do that, to understand how this happened and to ensure this kind of situation can't happen again or across government indeed.
It doesn't look good, though, does it? Because literally, just before I came on air, I don't know if you're aware of this, news broke that sensitive documents about the defence establishment and movements of our warships were discovered at a bus stop in Kent by a member of the public.
Yes, no, I'm aware of this as well, Trevor. And as I say, as you rightly say, it's something that none of us want to see. It shouldn't be able to happen. It was properly reported at the time into the Ministry of Defence. There was obviously an internal investigation into that situation as well. And we've got, again, I'm going to wait and allow the team at the Department of Defence to Ministry of Defence to work through that investigation to understand exactly how this managed to occur.
Mr. Javed, I gather, will be speaking to the press later on this morning. He's got a big in tray, completing the vaccine rollout, catching up with the backlog, maybe 5 million patients, unwinding the reforms from a decade ago, not to mention social care. The Americans have this expression, a hospital pass, which is when you throw the football to somebody who's about to be buried under 3 200-ton opposition defenders. Is Mr. Javed getting a hospital pass with the Department of Health and Social Care now?
No, not at all. I know the analogy. My football days may be a bit behind me, and I was probably one of those larger defenders you refer to, Trevor. But look, we're very fortunate in our party to have such a great depth of talent. And having Sajid Javid with such a phenomenal wide experience across government, leading key big departments, coming back in means we've got somebody who knows how to get things done, who knows how to manage and run a department. And he is going to be working with what is a phenomenal team at the Department of Health, really strong ministers, a team that's worked so well together through the pandemic to deliver for people across the country in the most challenging times that our health service has ever seen. And I know that Sajid will be absolutely laser focused on making sure that we're able to move forward in a positive way.
I suppose the Prime Minister reminded him that he's not just Secretary of State for Health, but also for social care. We understood that there was going to be the beginnings, at least, of a proposal for social care emerging this week. Will Mr. Javed still tell us what the government wants to do on social care, or is that going to be delayed yet again?
Well, the Prime Minister has outlined that we'll be coming forward with some plans before the end of the year. That will be the focus of the Department of Health. As I say, the whole team, Helen Whately and Ed Gallagher, the whole team working with Sajid Javid, who, as I say, will be somebody who is focused on getting things done and delivering. This is a hugely, we all know this, a very, very, not just sensitive, but a really complicated area. I used to be in local government myself. There's obviously a huge work across. Sajid has got great experience of that from his time at communities and local government, and understanding how that comes together and delivering something that can really work for people in a way that's fair and gets the job done, so people have got that confidence in older age to be able to look forward. So that is something we want to do by the end of the year, and I know Sajid will be focused on that as much as he is on that wide range of issues as we are developing out of the COVID pandemic.
Mr. Lewis, thank you very much indeed.
Thank you.
Matt Hancock threw in the towel 36 hours after his affair was exposed on the front page of The Sun. Last night, he released a video statement explaining why he felt he had to quit.
I've been to see the Prime Minister to resign as Secretary of State for Health and Social Care. I understand the enormous sacrifices that everybody in this country has made, that you have made, and those of us who make these rules have got to stick by them, and that's why I've got to resign. I want to thank people for their incredible sacrifices and what they've done. Everybody working in the NHS, across social care, everyone involved in the vaccine programme, and frankly, everybody in this country who has risen to the challenges that we've seen over this past 18 months. I'm very proud of what we've done to protect the NHS at the peak, to deliver that vaccine rollout, one of the fastest in the world. And I look forward to supporting the government and the Prime Minister from the backbenches to make sure that we can get out of this pandemic. We're so close to the end, and then build back better so that this country can fulfill its potential, which is so great. And I will do that with all of my heart.
The Labour leader, Sir Keir Starmer, has said that Matt Hancock was right to resign, but the Prime Minister should have sacked him. Why, the party asked, did Boris Johnson say on Friday that the matter was closed when it clearly wasn't? I'm joined now by Labour's Lucy Powell. Lucy Powell, Matt Hancock says he's sorry, he's let people down, and he's gone. Shouldn't that be the end of it?
Well, I'm afraid this goes to the judgment and the leadership of the Prime Minister as well, because Matt Hancock, yes, it's good that he's now gone, but he should have gone on Friday and the Prime Minister should have sacked him. And these are the difficult decisions of leadership. And I'm afraid it feels to me like the Prime Minister has a very dangerous blind spot when it comes to issues of integrity and conduct in public life. And that's a really big problem. And it's even bigger problem when you're in the middle of a pandemic and you're asking the public to also have integrity and conduct in the way that they go about with their own lives.
Are you going to oppose the severance payment that to which Mr. Hancock is statutorily entitled? I think it comes out at something like £18,000.
Well, I think most of your viewers would be appalled to think that there's going to be a severance payment to Matt Hancock in this circumstance. Let's not forget, he, as the Health Secretary, was the guy who recommended that our NHS workers, after the year that they've just had in this pandemic on the front line, who have worked flat out, who are now on their knees, he recommended that they in effect had a pay cut. And I think to find out that he's now going to get thousands of pounds as some kind of severance redundancy payment for, frankly, being caught on the job while he was on the job, you know, I think would be pretty disgusting to most people. And we will certainly be calling that out and asking the Prime Minister not to give him that.
Well, we don't know whether Mr. Hancock wants to claim it or not. So, to be fair, it's at the moment hypothetical. But to get an idea of how far you want to press this, when Professor Neil Ferguson conducted an extramarital affair, Mr. Hancock was one of his most vociferous critics. And actually, he said that he supported the call for a police inquiry. Do you think that the police should look into Mr. Hancock's behaviour?
Sorry, I couldn't hear that very well. Could you just say that again? It was something about a police inquiry, yeah?
Of course. I'm trying to work out how far Labour wants to push this. When Neil Ferguson ran into trouble, Mr. Hancock supported a call for a police inquiry. And I'm just wondering whether Labour would do the same in this situation.
Well, my colleague Fleur Anderson has referred this to the police because she wants to know, we want to know whether the police will be looking at whether Matt Hancock did break the law in his actions. At the time, you'll remember when this video was taken, we were all told that we could only have close contact with those that we were in a bubble with. They were our bubble. And that was the only people we could have close contact with. That was the law at the time. Yet it now turns out that Matt Hancock was actually in two bubbles at the same time, unbeknown to other people in that bubble. And that is how infection spreads. So, yes, there are serious issues here which need further investigation, and we will be looking at those because, of course, you know, Matt Hancock was the first to say that Neil Ferguson and others should have resigned when they broke the rules and that other people needed to abide by them. So you can't have the rule maker also being the rule breaker. People want to know there's accountability in that.
The government obviously wants to limit this to an issue of one individual's conduct, but I think from what Labour leaders have been saying, you think that this is endemic in government. And I just want to pick up on a couple of the points that you've made. You've said that Mrs. Coladangelo is an old university friend of Mr. Hancock's, appointed as a non-executive at the Department of Health. But, of course, that point was cleared by the Permanent Secretary of the Department of Health. Why go after them on that basis?
Well, look, I think there seem to be widespread issues here. As I say, the Prime Minister seems to have a really dangerous blind spot when it comes to these issues. We now also find out that Matt Hancock was using his own private Gmail account to undertake effectively negotiations and discussions about very large NHS contracts. That comes on top of other questions relating to Michael Gove, Priti Patel and others about the handing out of government contracts. And so, yes, there are some very serious issues here that seem to cut across the whole of government about how government contracts, government paid for jobs are being handed out and whether they're being done in accordance with those Nolan principles of public life and in accordance with the ministerial code of conduct, which I'm afraid the Prime Minister seems to disregard whenever it suits him. It's not really worth the paper it's written on at the moment. And so, yes, we will be pursuing those wider issues, and there are those wider issues across government.
It is, of course, the role of the opposition to point out the government's failings, to scrutinise it, to point out the issues of cronyism, charmocracy, all that kind of thing. But what would you do to change that? I mean, presumably, if you're making the case that this is characteristic of the whole government and not just a couple of one-off problems, there is something systemic that has to be tackled here. So what is that, and what would Labour actually do about it?
Well, I think it does speak to who does the Conservative Party represent here, in whose interests are they governing? Are they governing in the interests of a lot of their wealthy donors, their mates in business looking to make a fast buck off the public sector? Or are they governing in the interests of ordinary working people who are trying to get by in this country, who need decent pay, decent housing and decent jobs? And it feels to me time and time again that this Conservative Party, I'm afraid, are governing in the interests of their wealthy friends, and that's when it gets found out. So yes, it's not just about your processes and whether you've got strong leadership. And I absolutely believe that Keir Starmer would have sacked Matt Hancock or if it had been any one of us in this situation on the spot, and how you deal with them. But it's also about in whose interests are you governing, in whose interests are you a politician? And that's where the Labour Party and the Conservative Party really have quite a big difference, I think.
You say that Keir Starmer would have done this differently and been decisive and all that. But look, you're confronted with a government against whom you can and have made over many months credible charges of hypocrisy, sleaze, cronyism and sheer incompetence. Yet you managed to lose a by-election in a previously safe seat last month. You're in danger of losing another one this week, and you're way behind in the polls. How can that possibly be? I mean, how do you manage that?
Well, look, the by-election on Thursday has not happened yet. We've got a fantastic local candidate in Kim Ledbetter, who is a very passionate local community activist. She's not really a politician at all, and we'll be fighting for every vote on Thursday. So let's see what happens there. But of course, in a pandemic, it's not a time of politics as usual. People want to see the government succeed. We want to get back to life as normal, and we have to take a slightly different approach as the opposition. People don't want to just hear from us in terms of opposition for opposition's sake. They want to see us being constructive and working where we need to, working with the government to end this pandemic so we can all move on. And we're emerging out of that, I hope, soon. And, I think you'll hear a lot more from Labour over the coming months about how we'll deal with some of those underlying issues that this pandemic has exposed, the gross inequality in this country, in health, in wealth and in our public services. One
very quick last question, if I may. Sunday Times this morning says that some Labour figures are trying to persuade Tony Blair to stand for Parliament again. Might there be some Labour hearts going pitter-patter at the prospect of the return of the old boss?
I don't think so, no. We've got a very good leader in Keir Starmer, and we are all united behind him. We've got that T-shirt. We've watched that movie before where we turn in on ourselves and focus on these other issues, and that movie doesn't end well for Labour. So we are focused on being united and getting behind Keir Starmer so that we can put forward that compelling, radical, big offer to the country that we need to do at the next election.
Lucy Powell, thank you very much indeed.
Thank you.
Since the NHS was founded in 1948, the job of Health Secretary has been one of the biggest in the government. But right now, in the midst of a pandemic, it's probably fair to say it's bigger than ever. And while the immediate crisis of hospitals being overwhelmed appears to have passed, the long-term consequences will take years to deal with. More than 5 million people are now on NHS waiting lists. I'm joined now by the chair of the British Medical Association, Dr. Chaand Nagpaul. Dr. Nagpaul, do you think your members will accept Matt Hancock's apology at face value, or will they say that he's only stepping down because he had no choice?
I think what our members are saying is that they are feeling absolutely exhausted after 15 months of this pandemic. Many have worked flat out without breaks. They worked during the lockdowns when at the stay-at-home periods, busier than ever. About 4 in 10 say their mental health is worse than before the pandemic significantly. You have about 1 in 3 saying they are going to be retiring the next year. About 1 in 5 saying they'll leave the NHS or reduce their hours. And remember, this is on the back of about 8,500 unfilled doctor vacancies, about 80,000 vacancies in the NHS that have been unfilled. Now, this comes at a time when the new health secretary was going to see a baptism of fire. He won't have the luxury of a phased handover. He'll have to make every day count. We're facing, as you've said, a record 5+ million patients on waiting lists, and that includes about 400,000 who've been waiting more than 12 months. And that doesn't include about 20 million patients who were not seen in outpatient clinics last year. So we really do have not an issue of a backlog crisis of care, because many of those patients will become more ill as time goes on. Many of them have health conditions which, if they're not treated promptly, will become more serious. And what he will need to do is manage that crisis in a way that delivers prioritization, but also be honest with the public about the length of time it's going to take. And as a health secretary and a former chancellor, he's going to need to negotiate the resources that the NHS needs. The government has not costed for the several billions of pounds that are going to be needed to address this backlog. So he'll have to do that as well.
Dr. Nagpaul, we'll come to the issue of resources in a moment, but Mr. Javid will be talking to the press probably within the next hour or so. What's the most important thing you want to hear from him this morning?
Well, what I want to hear from him is, one, that he understands the workforce, because the health service cannot survive without its workforce. He needs to understand the pressures we feel. He needs to understand the fact that we need to have a proper rest and to recover before the onslaught of the recovery of the backlog of care that's going to need to be delivered. And he needs to value us. And he will have to also address the issues around pay and the derisory 1% uplift that has, distressed a lot of the workforce in terms of not feeling valued. But the other thing he's going to logistically need to deliver on is the vaccination program, because we are still in the midst of a pandemic. We have spiraling numbers of cases now, over 18,000 yesterday, new cases. We are actually seeing increases in hospitalization, not at the level of before, but it is impacting on hospitals at the moment. And he's going to have to get up to speed and make sure that the adult population, tens of millions of which have not yet been vaccinated, get vaccinated in the coming weeks. It's a huge challenge.
Let's take a couple of those points. The backlog. Other than saying he recognises how hard everybody's worked, the problems of morale, outlining the numbers involved in this, what does he have to do? What do you want him to say he's going to do to fix that?
So what he needs to do is, first of all, retain the workforce. He needs to he needs to speak to the British Medical Association, the Royal College of Nursing.
What signal would convince you that that's happening?
Okay. Well, one would be to be honest with the public of the scale of work so that he doesn't just put arbitrary targets that we just somehow can magic up delivering care and clear the backlog in the next few months. That just isn't going to happen. He needs to make sure that there are issues such as rest facilities. 40% of doctors say they don't even have a place to rest in hospital. He needs to make sure that we can take leave, we can recover, and then that we have a prioritization program where those patients who need to be seen first are seen first, and that he puts in place the logistics to make that happen. He needs to also make sure that we are valued, both in terms of the terms and conditions we work in, but also pay. And he needs to retain the workforce and also, I should mention, do much more with the retired workforce who are willing to come and help. The government did not avail of the retired workforce last year. They need to do that now, especially at this critical time.
That's interesting, because I was going to say, you know, we want rest, we want recognition of the pressure that people have been under, which sounds to me like you need more doctors like tomorrow, but you can't train them in less than 7 years. So would him saying, what I'm going to do is I'm going to pay and provide incentives for doctors to come out of retirement be the sort of thing that you're looking for?
Well, you see, I mean, obviously, retired doctors can't do, you know, they've retired, but large numbers have actually retired in the last 2 years. And so they can steadily bring their skills. For example, in terms of the huge backlog, they can be looking at the prioritization of patients. They can actually be providing a lot of the support by phone and video consultations in primary care, for example. But you're absolutely right. Ultimately, we have been running a health service that are tens of thousands of doctors short and tens of thousands of nurses short, and that recruitment won't be able to be delivered immediately. But obviously what he has to commit to is a training program that delivers that in the years to come. The other thing that I'd like to say is that we also have large numbers of doctors who come from overseas to the UK, and at the moment there are considerable hurdles and obstacles that are preventing them coming here, and they're going to other nations. We need to make sure that as a country we're offering those doctors who want to come and work here the ability to do so, and to not be and to value their contribution to the NHS. Many come here for training because they need postgraduate qualifications from centres of excellence in the UK, and at the moment many are being deterred from coming due to certain bureaucratic obstacles that need to be addressed.
Dr. Nagpaul, that's clear. It's more immigrant doctors, more doctors who may have retired who can help, perhaps, do things. You talked about pay. The BMA has been at war with every health secretary since the inception of the NHS. Ken Clarke once said that you've got to find a concession to give the BMA at least once a year. And Nye Bevan, who founded the NHS, said he was only able to do it by stuffing doctors' mouths with gold. Is all of this more to do with doctors wanting more rather than patients needing more?
No, I would absolutely refute that. And in fact, I don't think this is actually an issue about doctors per se. If you look at the healthcare workforce, you know, all of the healthcare workforce feel absolutely exhausted. They have actually delivered during the most testing period the NHS has faced since its inception. They've gone into work, exposed themselves to a deadly virus back in last March and April when we didn't even have enough PPE. I think about 800 or 900 healthcare workers have died. Many have fallen seriously ill. And large numbers, of course, have come from doctors and nurses from overseas and from ethnic minorities. I actually don't think this is an issue about any one sector of the NHS. The entire workforce actually does deserve recognition for its efforts, and it does deserve proper terms, conditions, and pay to reflect that. So I don't think this is about politics at all. This is about fair recognition.
Dr. Nagpaul, thank you very much.
Thank you.
One of the features of this pandemic has been people who make the rules for everyone else breaking them. It was a trend started back in April last year when Scotland's chief medical officer had to resign for going to her holiday home during lockdown. And now a humiliated Matt Hancock has quit because he was kissing his aide in the Department of Health, while the public were banned from hugging their loved ones. Professor Linda Bauld is a public health expert and a behavioural scientist. Professor Bauld, let's just start with the situation this week. Number of cases of Delta up 46%. Scotland recorded its highest number in a single day. Should we really seriously be thinking about lifting restrictions on July 19th?
Well, I think, as everybody said before, it should be data, not dates. And there are two things to say. The rise in cases, both from the test positivity, people coming forward for a test, and also the REACT and the ONS infection surveys, which are all pointing in the same direction, do so show a substantial rise. And I think that's a cause for concern. Where there is more positive news, though, is that the proportion of people who are going into hospital, as you know, Trevor, as a proportion of cases is far, far lower. For example, at the beginning of this year, it might have been 10 to 15% of people who would end up in hospital. Now it's about 5%. So if that trend continues and the hospital numbers, despite what Dr. Nagpaul was saying, some hospitals are under pressure, don't go up exponentially, then I think the government is under a lot of pressure to stick with that date. But all the researchers and the clinicians will be saying, let's make sure that the data is going in the right direction, a week or two before then, before we can say we're proceeding.
I want to come back to ask you about the behavioural science implications of the Hancock affair in a moment, but there is a behavioural issue here, isn't there? The more that we put the July 19th date up in lights, the harder it is for a government not to do it, or to do something that is in some way a variant of of people's expectations. Is this date thing becoming a problem?
I think the date thing is a problem, and there's a couple of reasons for that. The first thing is that when you sort of set a date like that and people are looking forward to it, it's a bit like going on holiday. You do start to relax a bit before you go on holiday. You're anticipating it, you're looking forward to it. And you also, I think people are thinking, well, if we've got that date, that means we're almost back to normal. So if we're almost back to normal, I might as well do those things now. And you can see that from the ONS Social Impact Survey that people's compliance with distancing has declined. Their contacts have gone up, of course, but more than we might have thought. And also from the UCL COVID social study, you can see compliance declining. So I think that is a risk. The other issue with dates, of course, is that it's the politics of it, Trevor, isn't it? All these sectors that have to plan very legitimately. And if the dates then change, they will be furious, as we've already seen. Even to the extent of taking the government to court. So it's a very, very tricky thing. And that's why I think it should be more communicated as a tentative date to aim for, but it might change. And governments are not very good at communicating that uncertainty.
Well, of course, the magic bullet in all of this is vaccination, isn't it? What level of double vaccination would you be comfortable with for a reopening? People have talked at one point about 60%. Now I think they're talking about 83%. What do you think is the right sort of level we should be looking at?
So we're all hesitant to pin an exact percentage on it because the science doesn't necessarily support that. But it's very clear when you have a more transmissible variant, you need to minimize the reservoir of the population that are still able to pass the virus on. And we can see that that is largely younger people. So we need to vaccinate more younger people, keeping in mind that people around the age of 40, but in their 40s, only about 4 in 10 of them have had the second dose so far. So I think we're looking probably at vaccination double doses of 80% ideally, if we can get there. And if you look internationally, Trevor, Israel, of course, had opened up and removed almost all restrictions, are now reimposing a few of them, primarily just face coverings in indoor places, until they can get their vaccination rate, which was higher than ours, at an even higher level in the face of Delta. So that's where we are at the moment. But, the vaccine program, despite concerns about supplies, is going well. And final point from me on this, the data that many of us had seen about hesitancy amongst young people is not borne out by what we're seeing in practice. Young people are very keen to get this vaccine, the vast majority of them.
You're not a politician, so I'm not going to draw you into the shenanigans that I've been discussing with others. However, what we've learned in the last year is public sentiment has a huge impact on the capacity to deal with this thing. So behavioural science has seriously mattered in the last year. Now, Professor Stephen Reicho, who I think you'll know, said yesterday that the Prime Minister's support for Mr. Hancock, quote, trashes all the advice given by scientists about building trust. Are you with him on this?
Yes, I agree with Steve. And as Steve has also said, Hancock lost moral authority, public trust, and the Prime Minister supporting him, even for a short period. You know, I mean, even a day is a long time in politics, I think Steve has also said, was very unfortunate. I mean, Mr. Hancock has done the right thing, I think, by resigning. Quick action makes a difference. Just to tell you briefly, Trevor, about a study that my colleagues at UCL did around what happened with Dominic Cummings. Of course, that dragged on for ages. There was no resignation. And you can see that public trust in the UK government was badly affected by that. In the period after the event in May and for the 3 weeks afterwards, they looked at that and compared it with public trust in government in Scotland and Wales. In those citizens' own governments didn't decline, and also public's trust in the NHS, etc., didn't decline. So it was a Cummings effect in relation to the UK government. So I think the problem there and the behavioural message is we can't have one rule for them and another for us. That divides the country. And if the government is asking people to change their behaviour, as they still are, and comply with public health guidelines, they need to do it themselves and lead by example. So now that Mr. Hancock has resigned, you know, we need to look ahead, and Mr. Javid has a huge task on his hands, as Dr. Nagpaul and others have been saying. There's still much to do, and I hope we can just crack on.
Mr. Hancock has gone, but Mr. Johnson is still there. Now, speaking for yourself as somebody who has, I think, consistently tried to support the government in its efforts, how are you feeling this morning about trusting the Prime Minister?
Well, I always try and stay out of the politics, as you know, Trevor, but what I would say is that we have had some really damning news this week about performance, you know, in a whole variety of ways. Most importantly, the National Audit Office doing another review of test and trace in England and showing that there were still multiple failings. So I do think all governments around the world are struggling to deal with this pandemic. Some have done it much better than others. And I think there are big questions about what's happened in the UK. And we need strong leadership at a time like this. And there's been many unfortunate examples. So, as I say, I'm feeling optimistic still about the next few weeks, the vaccine programme, and hopefully vaccines will begin to impact on transmission. But as we look to the COVID recovery, which is what all of us want to do, we need strong, firm leadership that we can trust across all parts of the UK. That's what people living in this country deserve.
Professor Bauld, good to talk to you as ever. The NHS in England employs around 1.5 million people, making it by some distance the country's biggest employer. And as we've learned over the past year, it's a service that at some point all of us could depend on to save our lives. From that perspective, there's no more important job in the Cabinet than the Health Secretary. Let's talk now to a man who's been there and done it. Alan Johnson, Sajid Javid's going to be making his first appearance as Health Secretary in the next hour or so. What do you think he should be the first thing he does as he sits down at his desk?
Get a proper briefing about what's going on. He has got the luxury of being appointed at the weekend, so sometimes health secretaries and other cabinet ministers are appointed in, you know, at lunchtime, and then at 2 o'clock have to go onto the floor of the House of Commons and stand at the dispatch box and act as if they are all knowing about every issue in their department. Sajid's got at least got a few days. I think he's a good appointment, by the way. I think, you know, in a cabinet of sycophants, which has been one of the problems, he stands out because he refused to accept the outrageous demands placed upon him by the Prime Minister and Dominic Cummings, and, you know, gave up his job as Chancellor on an issue of principle. And I think that stands him in good stead. He's got a huge, I mean, it's not just the virus, by the way. The NHS is going to go through a huge change, a beneficial change, because they're going to reverse all the Lansley reforms. This is part of the NHS plan that the government thankfully have accepted, and go back from a system where they were, you know, you almost had to have a competition lawyer in the corner every time one hospital talked to another. They're going to go towards cooperation and integration, and that's a very big and very beneficial change, and it has to be put through in legislation over the coming year.
You mentioned Dominic Cummings, and I'm afraid I just can't resist asking this. Do you have any sympathy for how Mr. Cummings might feel this morning, having, in a way, got rid of his nemesis? He said Hancock should have been sacked 15 times last year and so on, and no doubt have been cheering when Hancock went, and then to find he's been replaced by the bloke that walked rather than take Cummings' orders. It must be a bit disappointing for him.
I have absolutely no sympathy for Dominic Cummings at all, and neither would he require sympathy. But you know, what he said about Matt Hancock's failings are all there in a wonderful book called Failures of State by the two Sunday Times Insight journalists. It was published back in March. And strangely enough, although it contains every dot and comma and much more of the disaster that was this thing that Hancock did. I mean, Hancock took 15,000 people out of hospitals and put them into adult social care. So he took the most vulnerable to this disease and placed them in the area where they were most likely to get it. It had terrible, terrible consequences. Hancock's point was that he told the Prime Minister that it had all been done safely or whatever it was, but read the book, Failures of State. It shows how there were absolutely no safeguards. All the regulations were suspended for this mass migration of elderly people out of hospitals and into adult social care. It was a disaster, and one of many disasters in those early days that hopefully will come out in the inquiry when it's eventually held.
We're hearing about further, let's call them, failures of state this morning. We are hearing about personal email accounts being used when perhaps they should not. And we are hearing about the inquiry, which Brandon Lewis told this programme will be mounted into how those pictures of Mr. Hancock and his aide were found. And of course, we've now just had news that sensitive defence documents were found at a bus stop in Kent. Home Secretary, Health Secretary, this must be the sort of nightmare that you wake up sweating about.
You might remember, Trevor, because like me, you go back a long way, Alistair Darling getting castigated over some NHS records that went missing back in 2009, I think it was, and they were Treasury documents. And I hope the same kind of castigation is going to fall upon this government. On the first issue, I could never understand why there was a camera in the Secretary of State's office. There was never a camera in my office when I was Health Secretary or in any of the other 5 cabinet positions.
I think the rule is that cabinet members are not to be monitored by anybody, including security services, without express permission of the Prime Minister.
Exactly. Yeah, it goes back to Harold Wilson's time. Although, of course, our telephone conversations, there's always someone listening in. There's a member of your private office to get a record so that you've got some justification and some backup for what's talked about. So this private telephone account of Matt Hancock's, through which apparently he negotiated some of these extremely questionable deals for his mates to get large lumps of taxpayers' money, that's certainly worthy of investigation. So there are problems here that need to be looked at and go beyond Matt Hancock. But as for Matt, I mean, you might have covered this, Trevor. I thought when this Neil Ferguson issue arose, Matt Hancock didn't have to pile in on Neil Ferguson. He chose to pile in and say that Neil Ferguson had a visit from his girlfriend,
yes,
that it was extraordinary behaviour and that everyone had to obey the rules, and even went so far, although the police had declared they were not going to take any action for this breach of law, Matt Hancock said, if they do take action, I will support them. I mean, it's talk about, a justified comeback. When you do that to someone, a sage advisor, it wasn't even a cabinet colleague, someone who couldn't really answer back, you deserve everything you get.
Alan Johnson, let's take it away from the person for the moment. What is emerging about the culture of this Department of Health? Contracts allegedly granted to cronies. We don't know to what extent Matt Hancock was involved in any of that, but the story that's being told is that there's cronyism, that there's a charmocracy, that email accounts are being used to keep information away from officials. Now, you were there, I think, for a bit more than a year.
2 years.
That long, okay. Did you get any sense of that being the sort of underlying culture in this department?
No, and I think you can't divorce it from individuals. I think this is a Boris Johnson style government. Maybe Cummings was in there as well. All this, well, let's waive all the rules, bonfire of the rules and do what we want to do when we want to do it. I was also there through a pandemic, of course. It wasn't as extensive as this one, but we thought it was going to be. It was the return of H1N1, Spanish flu, that killed billions of people, literally billions, back in 1918. It had come back, and we thought it was the big one. So I saw how the NHS operated, and I had real admiration. There's, the chief medical officer working with the NHS, working with the department. It's a tricky organisation to run, but there was nothing about that organisation that suggested cronyism or anything else until the kind of government cronyism came in.
Just very briefly, Alan Johnson, how will you judge Sajid Javid, or what will be the key performance indicators on which you would judge him, leaving party politics aside, on whether he has been a good health secretary or not?
Well, I've left party politics aside to welcome him. I think he's a good appointment. I think he's the best possible appointment, other than perhaps Jonathan Ashworth under a Labour government. But I think Sajid, getting on with his job quietly, undemonstratively, and in a measured fashion. That's what the NHS want to hear. He needs to get out there amongst the NHS. They don't want someone who's looking for headlines every evening and who's looking to kind of climb the greasy pole. Sajid's already done it. I mean, he's held two of the...
Are you saying that... Are you talking about anybody in particular there?
Maybe. Not me, I assure you. But that's why you can't divorce it from the personal. I mean, Jeremy Hunt was in many ways a very good health secretary. In the years he did that job, I've got my issues with him, but, he sort of exuded confidence and quiet, modest, a quite modest approach to politics. And I think that's what Sajid will bring as well.
Very generous of you. Alan Johnson, thank you very much indeed.
Thanks, Trevor.
Well, that's it for now. After the break, we'll be talking about what we've learned on this morning's programme with our Deputy Political Editor, Sam Coates.